A critical appraisal of Dr. Gene Watson's theory of human caring. Nursing theory is a construct of ideas that shape the way a nurse views the practice of nursing or a nursing situation. A nursing theory is used to guide a nurse when choosing their actions. Nursing theory can provide a knowledge base that serves specific and broad aspects of the nursing practice. I will discuss Dr. Gene Watson's theory of human caring. This is considered a middle-range theory, which means it describes the correlation between two or more concepts and how they affect outcomes. Watson's theory was developed between the years of 1975 and 1979 while serving as faculty and an administrator at the University of Colorado. According to Watson, by using views of nursing, combining doctoral studies in educational, clinical, and social psychology, her theory came to fruition. Watson experienced the loss of her left eye in an accident in 1997, then the loss of her husband and spiritual partner in 1998. Healing from these wounds with the help of family and compassionate nurse friends helped to bolster Watson's life's work. Watson's theory model promotes health by focusing on restorative, holistic health and is concerned with how a nurse carries out their practice by combining scientific knowledge and caring. Watson's theory explains that when nurses focus on and demonstrate caring, this provides an environment in which the patient will flourish. Because according to Watson, the patient will feel accepted based on who they are and looks to the future with hope in what they are capable of becoming. Watson believes that when this theory is practiced in nursing, that it facilitates all-encompassing or holistic health and is key to the practice of caring within the nursing field. Watson's theory consists of 4 major concepts, 3 sub-concepts, and 10 curative factors. The word curative is used by Watson instead of the word curative to express ways to care in order to promote wellness instead of ways to cure. The 4 major concepts include human being. Is the patient being cared for, being understood, valued, and assisted? Society. The values provided by an environment to the patient and what that person should want to achieve. Health, the absence of illness or one on the path of wellness. Nursing, professional, personal delivery of ethical care by those in the field of science. And 3 sub-concepts. Phenomenal field, personal opinion of the experiences overall that a person has thus far in their life. Self, how the person perceives themselves compared to perception of others and their life. Time, the concept that the past is not happening currently, is different than the present, and the present is more of a current reality. The combining of past, present, and future events. I will now list the 10 curative factors which paired with a caritas process or action. Each paired with a caritas process or action that fulfills the human need of caring utilized by the nurse. The first 3 are the blueprint for Watson's theory, and the other 7 stem from those. Number 1, the formation of an unselfish and compassionate system of values. The nurse will practice loving kindness and calmness even in a difficult moment. Number 2, establishing faith and hope. The nurse is being present to the fullest extent possible, holding on to a belief system, self-awareness, and the meaning of feeling cared for. Number 3, instilling sensitivity within themselves and toward others. The nurse connects with their own personal beliefs and awareness beyond themselves. Number 4, cultivation of a trust relationship that is there to help. Develops a lasting relationship with the patient that is real and feels caring. Number 5, encouraging acceptance of oneself as well as the ability to express whether they are negative or positive. The nurse shows up for the patient and supports expression of all feelings as a connection of spirituality as well as the patient. Using the scientific problem-solving method to make decisions. Number 6, using the scientific problem-solving method to make decisions creatively and with a caring process. Using nursing knowledge and self-awareness, they utilize the art of caring in the nursing process. Number 7, promoting transpersonal teaching learning or beyond one's own belief with a wider outlook on all of humankind. The nurse uses the perspective of the patient to engage them in an authentic teaching learning experience while preserving the tone of the patient's awareness of themselves. Number 8, providing a safe environment that is protective and stable, spiritually, both mentally and physically. The nurse creates a physical and spiritual space that is dignified, that preserves wholeness, comfort, and peacefulness. Number 9, facilitate basic needs of human survival. The nurse assists with or obtain resources that in a caring and conscious way provide essentials of survival with a holistic, complete focus while honoring the values and belief system of the patient. Number 10, allowing questions of his existence and being both physically and spiritually. The nurse will hold a safe environment and provide strength to accept life and death with consideration to a patient's point of view. Watson's theory addresses a hierarchy of needs. Lower order, or biophysical, includes foods, fluids, elimination, and ventilation. Lower order, psychophysical needs for activity, inactivity, and sexuality. Higher order, psychosocial needs of achievement, affiliation, and self-actualization. Watson's theory in nursing practice reflects the nursing process and the process of scientific research by using assessment, plan, intervention, and evaluation. The nurse must observe and identify problems, then form a hypothesis. Creation of a care plan, collecting data, and intervening could lead to the discovery of other ideas. I chose Watson's theory because I felt drawn to the idea of caring for each individual as a whole person with an open mind and compassion as a method to establish an environment of healing. Some of Watson's theory seems without direction or direct instruction on how to achieve the caring environment in a timely way. I do think that theories are helpful in teaching nurses about different ways to view the nursing practice or to handle a situation. I think it would be useful to use different theories to formulate nursing plans and to expand our knowledge as nurses. It seems helpful to have a blueprint as to how a nurse should view their practice to guide through a difficult situation. Now let's look at a scenario. Mr. Gordon is an underweight 60-year-old white male who is experiencing homelessness. He is estranged from his 2 children who are in their 30s. Mr. Gordon is a non-practicing Catholic who lost his wife to cancer 3 years ago. He is an alcoholic who is currently trying to detox and has not had alcohol in 4 days. Mr. Gordon comes into the emergency room on his own, complaining of weakness, shortness of breath, and tremors. He has been diagnosed by the ER physician as having congestive heart failure and is admitted to the hospital. I am a nurse assigned to Mr. Gordon. Here is the application of Watson's theory of human caring, starting with the 4 major concepts: human being. Mr. Gordon is on his own, he is not being cared for, has no support system. He does not appear to be valued. He is now at the hospital receiving care, support, and being valued as a whole human being. Society. He is viewed by society as a burden and is not safe without a home. His environment is not supporting his health and well-being. Now he is in a nurturing environment with a nurse who can control his environment. Health. He is ill and did not have a path to wellness. He is in the presence of nursing efforts that will concentrate on his medical care and wellness. Nursing. He has a nurse now delivering professional care. Next, the 3 sub-concepts. Phenomenal field. Mr. Gordon does not have a healthy outlook on his recovery and says he feels hopeless and weak and does not want to go on without his wife and children by his side. Self. Mr. Gordon has trouble talking about himself with respect, and he says that he feels shame about letting his kids down. Time. He does have an awareness of time and what is currently happening. I tell Mr. Gordon that even though the past has been difficult, we will move forward together and find a solution to help him get well. Now I will take this scenario through the 10 curative factors. Number 1, the formation of an unselfish and compassionate system of values. I will practice loving kindness and calming even in a difficult moment. I speak to Mr. Gordon calmly, kindly, and respectfully with love in my heart. Number 2, establish faith and hope, being present, hold on to my belief system, meaning of being cared for, and self-awareness. I remain present and look at him in his eyes. I assure Mr. Gordon that I know in my heart that he is in the right place to get healthy, and together we will move forward. I ask him if there is anyone he would like to speak about his faith. I offered to call the chaplain to pay him a visit. He says he would like that. Number 3, instilling sensitivity within myself and toward others, connecting with my own personal beliefs and awareness beyond myself. Mr. Gordon begins to cry. I hold his hand, let him know that it's okay to release his pain. The patient care technician comes in the room with his dinner tray. I ask them to stay and help Mr. Gordon eat while I call the chaplain. Number 4, developing a trusting relationship. I show him that I am here for him and that our relationship is lasting and real and that I care. I assure Mr. Gordon that I will return shortly, giving him eye contact and letting him know that I care about him. Number 5, acceptance of self and one's feelings. I show up for the patient and support feeling as part of a connection to the patient and to his spirituality. I allow Mr. Gordon to feel sad and honor his space. I give him a chance to express how he feels about his wife and children. Make decisions creatively with a caring and scientific problem-solving method. I use my nurse knowledge and self-awareness while using a caring and nurturing tone. I need to change a wound dressing on his leg and his IV site, but Mr. Gordon is crying. I ask my patient care tech to come in and hold his hand while I continue to ask him questions about cherished memories he has had of his wife. I am able to complete the tasks as he smiles and reminisces. Number 7, promote transpersonal learning beyond my own beliefs. I use Mr. Gordon's perspective to engage him in an authentic experience while preserving his self-awareness. We run through what his care will look like, and I take time to answer his questions. Number 8, provide a safe and stable environment spiritually, mentally, and physically. I make sure that Mr. Gordon's environment feels safe, is quiet, and comfortable. I ask Mr. Gordon if he feels comfortable and safe in his room. He seems nervous, but he says he does. Number 9, facilitate basic needs of human survival. I will assist with obtaining resources in a caring and conscious way while honoring Mr. Gordon's belief system. I assure them that I will get everything he needs while he is here and will connect him with someone who will discuss a place to live or resources that are faith-based and work with compassion. Number 10, allowing questions of existence physically and spiritually. I allow Mr. Gordon to express himself and let him know that this is a safe place to do so based on his point of view. I hold his hand and tell him we will eventually feel stronger and that he may even find more strength through his faith to get him through this tough time. I let him know that the chaplain is on his way to meet with him. As I run through Watson's theory with this scenario, I realized that time would be limited, unless I had a very light patient load that day, which is highly unlikely. Although the theory provides a blueprint for a very rewarding nursing patient experience, it seems difficult to follow through completely since he is so critically ill. I also found myself questioning my own strengths in self-awareness and faith. According to Watson, those ideas must be firm within the nurse. Also, how can I be sure that the patient feels safe and secure in our relationship and in their environment? Surely that would be difficult depending on the situation. Overall, I think the theory is very useful to provide a holistic and caring experience, but seems at times unattainable, inefficient with time management, and could be difficult for some nurses to grasp the concepts.